My name is Greg Canellis, and I'm a senior in the dental assisting program at Tri-County. I'm here to discuss with you different tips and techniques on how to have good oral hygiene during your orthodontic treatment. If you would like to join me at any time during this video, you'll need the following: a toothbrush, toothpaste, and orthodontic floss. So right now I'm going to break down the mouth for you so you have a basic understanding of what you're dealing with. The mouth is broken into two different arches, the top arch and the bottom arch, other known as the maxilla and the mandible. Now these arches are broken into four different quadrants. You have an upper left and an upper right and a lower left and a lower right. Now we're going to move on to brushing. So grab your toothbrush, wet it, and put a minimal amount of toothpaste on it, and follow me here. When you brush, you want to place your toothbrush at a 45-degree angle. So we're going to start at the top and we're going to place it at our angle. So this touches the gums and the teeth. Now we're going to do a circular rotation for every quadrant. After about 30 seconds, we're going to move on to the middle of the teeth. So you're brushing the wires. After another 30 seconds, you're going to want to move underneath the teeth so it gets the bottom of the wires and the rest of the tooth. You're going to do that for every tooth and every quadrant. If you would like to, sing the happy birthday song because that does help. So now we're going to move on to flossing. This right here is orthodontic floss. Orthodontic flossing requires much more patience than normal flossing because you have braces on. So now I'm going to demonstrate flossing with braces. So I'm going to start at the top arch, but you can start wherever you would like. You're going to thread the floss through the tooth, just like this. You're going to put it in between the teeth and seesaw it back and forth. And then you're going to pull out. Now I'm going to do a bottom tooth example. Thread through, pull through, seesaw, and pull out. Now you're going to do that for every tooth and between every surface, so make sure you have a lot of patience. Next, we're going to talk about Angle and his classifications of occlusion. Angle created his classifications of occlusion a long time ago. He created 3 of them: Class 1, Class 2, and Class 3. Class 1 occlusion is when you have a perfect bite. Your mouth is absolutely in perfect shape. Class 2 occlusion is when the top arch jets forward from the bottom arch. Class 3 occlusion is when the bottom arch jets from underneath the top arch. Now, orthodontists use elastics to determine what type of classification you want. Everyone should want Class 1 occlusion. If you have Class 2, orthodontists may have you wear elastics like this to correct that occlusion. You may have to wear them 24/7, or you may have to wear them only for a couple hours in the day. But make sure you pay attention to how long you have to wear them for, or else your bite will not be corrected. Next, we're going to talk about retainers. Retainers are the last stage of your orthodontic treatment. They look like this. There are many other retainers, but the most commonly used retainer nowadays is the Essex retainer. Once you get your braces removed, the retainer is used to keep the corrected alignment that the braces did. So, you're going to take your retainer, place it on your teeth, and you're going to leave it in there for as much time as the orthodontist has recommended. Ways to clean your retainer are as following. You can use a tablet called Retainer Bright, or you could also use antimicrobial soap. That gets rid of all the bad germs. Now, please refrain from using mouthwash or toothpaste. They make the retainer very rough. So, within this video, I've talked about the mouth, brushing, flossing, occlusion, elastics, and retainers. I hope you got something out of this video, and I hope you have good oral hygiene during your orthodontic treatment. I appreciate your time, and thank you for watching this video.